Hey everyone, welcome to week 6. I hope you all had an amazing time with your family and friends this past week. This week, I wanted to remind you all that your case presentation is due. So please be mindful that I'm looking for all of you to be using the skills that we've learned throughout our time together this semester. And also make sure that you're focusing on the alleged problem that the client is coming to you with. I'm finding that a lot of you are getting distracted by the many problems that are coming up during your session, but always being mindful that the core problem is what we're there to assist the client through. Um, so if you should have any other questions or need any help, please feel free to email me and let me know. So this week we're going to be working with people with disabilities. So the definition of a developmentally disabled person is a physical or mental impairment that develops prior to adulthood. So some common developmental delays that you're going to see throughout your career are definitely IDD, intellectually disabled, autism, cerebral palsy, and Down syndrome. Those are the most common that we're going to encounter throughout our career. So now, most of you, as you know, developmentally disabled diagnosis can be severe or not as severe. For example, you could have a client who is a nonverbal autistic patient who's showing a lot of aggression compared to you could still have another patient who's diagnosed with autism, yet it's a more mild form. They're very active. They might just be social. They have social anxiety, and they might be a little bit socially awkward. So the severity level when dealing with a developmentally delayed client is very crucial to helping understand where they are in their line and how we can assist them as clinicians. Now, unfortunately, we have some developmentally disabled clients that never live on their own. They need to live in group homes or they have support live-ins. And some may be completely independent, and some may have a support live-in that comes for a few hours a day, or some that come maybe, one day a week. So it really depends. Now, every state is completely different. Some states believe in the group home model, where after the age of 18, they could be eligible to live in a group home supportive setting or an independent living supportive setting that the state has planned for them. Others believe in a community model, which is more based on keeping them in the home and just providing support. So I really encourage you to make sure that you understand your state's resources and your state's laws, because as I stated, every state is completely different and it affects your clients. So please be mindful of your state's resources and how they allocate that money for the developmentally disabled as well as mental health, like we talked about last week. So now it's not surprised that some of the same clients that we deal with who are developmentally disabled also are known in the mental health world. So a lot of them unfortunately come to the mental health world, maybe possibly even a hospitalization due to their aggression, due to paranoia. Sometimes it can even be psychosis, and it can be exhibited in developmentally delayed people. Now, this tends to confuse society a lot because they don't really know what category they fall in. Are they developmentally disabled or do they have mental health? Some institutions don't understand, especially schools. I find that schools like to put one client in one category. And as we know, a client does not fit into just one category. So really breaking down those barriers is really huge. So now most of these clients can be labeled as dangerous or out of control because they don't fit into that one label that I was just discussing. So for young children, you have them in specialized classes. They may even have IEPs or 504 plans in order to stay in the classroom setting. A lot of states now have developed the idea of mainstreaming. So that is putting developmentally disabled children in, as they call, regular or normal classes. So you may see or hear, if you have children or grandchildren, that there is that one kid who has an aide in the class. That is to assist them in the mainstream. Sometimes that works and sometimes that doesn't always work. So as I stated, some states have adopted that and other states have not adopted that. So our role as the social worker with the developmentally disabled population is key to their success. The earlier their intervention, the better chance for success. So the best thing is working with parents to assist in education of managing behaviors and symptoms. Most parents, they're very much in denial. When their 2-year-old begins to start headbanging, or they don't speak, or, they can't walk, it's very challenging for parents. And, they tend to push our interventions out of the way because they are very much in denial. But the best way for us to assist the client in succeeding is to educate their parents on what we can do to assist them. And unfortunately, in my career, I've met parents who are well into their 70s or 80s who are still caring for their developmentally disabled child, except they, in their mind, feel like they've done everything they can throughout their entire life, but yet they haven't gotten the child any access to services. So now we have this 40 or 50-year-old young man or woman who just for the first time is coming into contact with services. They're not going to be as kind because their entire life, all they've ever known is mom and dad taking care of them. And unfortunately, they're going to be in that line of mom and dad will pass away soon due to their age and health reasons. And now this 40 or 50-year-old developmentally disabled client is on their own. It's very common in our field, and it's very sad. And it really takes a lot of processing with developmentally disabled clients to really understand that. So as social workers, we also really want to make sure we're getting the background to provide support. Every developmentally disabled patient, could they have been exposed to drugs in the womb, alcohol in the womb? Could they have been exposed to trauma in or outside of the womb? Was the belly hit during mom's pregnancy? Was the child hit when they were young? Were they dropped? Those are all things that you really want to make sure that you know prior to working with the client, so you can get a better background and better understanding about what's going on. Unfortunately, children who have developmental disabilities are more likely to be abused because people assume that they can't express themselves. So I challenge you to approach every developmentally disabled client like they have been, because unfortunately, more than likely they could have been. So the aggression that I talked about is very, very big in developmentally disabled clients. And the aggression, people question, is it related to the diagnosis? Is it that his autism, is becoming more severe, or his Down syndrome? Is he growing into himself? Is this his behavior? Is this just normally him? Or does the aggression only happen in school and only happen toward the teacher, or only happen toward the caseworker, or only happen toward mom? That's what you really want to focus on, because if the aggression, for example, is happening in one isolated area and one isolated incident, there's trauma there, because that means that the developmentally disabled person is reacting to that trauma because they don't know any other way to react besides that, because they truly can't, sometimes they can't really express themselves. They don't know what to say. They don't know how to say it. So I challenge you to always think bigger when it comes to a developmentally disabled client, and not just automatically thinking, well, they have a diagnosis. This is probably just them growing up, their hormones, they're escalating. Yes, that could be true, but there also could be something else going on. So I really want you guys to make sure that you are looking at all aspects. Now, working as a therapist for developmentally disabled clients, they tend to gravitate toward more of the artsy side of things. So a lot of them really like to draw. They like to model with clay. They like to paint. A lot of them like to sing as well. So sometimes we need to really think out of the box and do a lot of play therapy with them to help them understand. Maybe when you see their drawings, you can assist them in drawing a picture of what they would like to be. Or, what happens when, John Smith gets mad compared to when John Smith is happy. You need to really make sure that you break it down very simple for them so that they can understand, yet they're going to be showing you through their drawings how they feel and what they mean. And that's really key to helping with therapy. Some developmentally disabled clients are going to be able to sit through talk therapy, and most, unfortunately, will not be able to because they just cannot process it for themselves. Now, there's a growing need for adult developmentally disabled support. There's a lot of focus on the child and adolescent population because that's unfortunately where a lot of them become found out. Especially in our day and age, our resources are a lot better than they were 20 years ago. So, diagnoses are happening earlier, intervention is happening earlier, but unfortunately, we're still looking at, as I stated with my example earlier, parents who feel like they can intervene with their child, and this child has not had intervention for 20 years. So you are going to encounter adult patients like that. And, the resources are very, very scarce. You have parents of developmentally disabled clients that are passing away, leaving these clients without support, and they can get mixed up in the criminal justice system as well as the mental health system due to the lack of understanding. So, as I stated, as social workers, I really want you to challenge the system and advocate for these clients because they're extremely vulnerable and they're unable to speak for themselves. So, fight for the resources for your patients of all ages, especially with developmentally disabled, because they need our intervention. So I think that there's a lot of need in this particular population. I think in the social work world, we focus a lot on mental health, a lot on those typical diagnoses that run in the DSM-5. But unfortunately, a lot of these behaviors that we just talked about, autism, Down syndrome, cerebral palsy, there's not really a lot of resources for these types of clients. So really make sure that, like I say, that as social workers, we're always being advocates and we're always challenging the system because unfortunately there are not a lot of resources out there for these types of clients. So if you are watching this, please send me an email about what developmental diagnosis you find would be hard to work with and why, and I will give you an extra 0.5 on your case video. All right, everyone, I hope you have a fantastic week. Let me know if you have any questions or need anything. Thank you.